Good morning, Arkansas. Well, the heat of the summer is right around the corner. It seems like we've already experienced a little more than normal, especially this time of year here in Arkansas. But there's some important things you need to keep in mind when you're outside in Arkansas in the summer, in the spring, if it's as warm as it has been here already. Dr. Doug Borg is here from St. Vincent's Heart Clinic to talk a little bit about our heart specifically when we're out and about. Welcome to the show. We're glad you're here.
Thank you for inviting me.
Let's first off talk about healthy people in general. You're a pretty healthy person. You still need to be careful out there in the heat.
Yeah, the average person, I tell people that really they need to worry about three things. And the summer is a great time to do this, is diet, exercise, and weight loss. So for diet, it's a good time. There's lots of healthy foods available, fresh food everywhere. So it's a great time to take vegetables, grill them, kebabs, any kind of grilled corn on the grill, that kind of thing is a great way to get vegetables into your diet.
And we're right across the street from the farmer's market.
Yes,
you can come down and support our local farmers and buy great produce to eat.
Another thing you could try are fries that are baked instead of frying French fries. That's another thing. And then increasing your fish intake, I think, is a good thing as well. One of the really important things, especially in the summer, because we all love our barbecues and our outdoor dining, is really need to watch your salt intake. And I mean salt, I don't mean sodium. So it's not so much the salt shaker that gets people, but it's
because a lot of people say, I don't put any salt on my food. I don't even eat salt. But there's so much sodium in a lot of that stuff.
So one fast food burger has up to 2,000 milligrams of sodium in it. That's over half of the recommended daily allowance. So really know what's in your food, reduce the fast food, use leaner products if you can. So I think those are all good ideas.
Okay, and then doing some exercise.
Yeah, so this is a good time. If most Arkansans really don't like to exercise in the winter. I personally think it's just fine, but a lot of people hate it. So really they start to get out in the spring and in the summer.
Well, swimsuit season, Dr. Borg. You got to get fit for the summer.
So it's a good time to get out and exercise, but you have to know your limits, and especially avoid the heat of the day. That's a big problem. But the other thing is that you want to make sure and stay cool. Want to make sure to avoid dehydration and know your limits. So for instance, my father, he decided to play the father-son tennis tournament with both myself and my brother when we were in junior high, and on his 5th match of the day went into terrible heat-related cramps and dehydration, and I think he still regrets that to this day. So I think you
because
really
he just didn't realize if he didn't do that on a regular basis, he shouldn't try to do it all at once.
If you're playing a nightly softball league and you have a marathon tournament all day on a Saturday afternoon.
And you're drinking maybe some alcohol along the way?
Yes, that's another thing. Yeah, people that are at risk for heat-related problems are either the old, the young, people that are not drinking enough, or certainly people that are overindulging, so to speak.
Okay. Now, there are people out there that know they have a heart condition, still want to be outside, still want to maybe even do some exercising outside.
Absolutely.
What are some things that they need to keep in mind?
Well, number one, most heart patients are on some medications, and so certainly we want you to be regular with the medications. If you have a heart condition, you're just going to be more sensitive to some of the problems that the average people are. So don't take your heart medications and then go outside in the heat and to get dehydrated, etc. And if you have heart failure specifically, or heart weakness, you really can't overindulge in your salt. I mean, it's really, really important to watch your salt intake. You really just have to magnify what the average person does.
Okay, so those people with a heart condition that know, what about people that may not know they have a heart condition? What are some signs and symptoms that they should be aware of?
Well, a lot of people have fluid retention. They just see it in their legs, or they see it, in places that they don't expect it. Maybe they're a little more short of breath. These are all reasons you should probably go see your doctor. Certainly, if you have more difficulty, usually it's a slow progressive kind of thing. So people will be like, I could do all sorts of things last year. Now this year, I just really struggling to do even kind of the average sort of things that I used to do. And so those are tip-offs. It's not necessarily because you're getting older. It's just because, maybe you're out of shape. Maybe that's all it is. But at the same time, if it's a noticeable difference, you should talk about it with your doctor for sure.
You need to go make that doctor's visit. And if you do have chest pain, which I think all of us in our life have thought we had some sort of chest pain at some point, when do you know it's serious?
Well, if you just had a chili dog and you've got burning in your stomach region, chances are that's not related to your heart. But certainly anything that's unexplained, that is persistent, that does not improve with kind of the average measures, or doesn't go away, then those are reasons. It's always better to be safe than sorry, and we always tell that to all our patients. I'd much rather you come in and be evaluated. Absolutely.
All right.
Especially if you're having any chest pain with exertion, that's really important.
Okay, Dr. Doug Borg with St. Vincent's Heart Clinic. Thanks so much for coming in. Some great tips as we get into the heat of the summer here in Arkansas. There's the information on your screen for the Heart Clinic of Arkansas.